Well, hello! Good to see you again. You probably thought that you would not see me again. Foolish little you. We'll now take a quick look at an important set of muscles. The muscles of mastication. The muscles of mastication are four pairs of muscles that are used for chewing. They are also used to open, close, and move the mandible. The largest of the muscles of mastication is the Masseter Muscle. Here is a picture that shows you where it is located. Put your hands on the sides of your face, just in front and below your ears. This is where the Masseter Muscle is located. With your hands here, clench your teeth. Now relax. Now clench. Now relax. Do you feel the muscle contract when you close down? That's the Masseter Muscle you're feeling. The Masseter Muscle starts or originates on the zygomatic arch. Do you remember where this bone is located? I hope so. The Masseter Muscle inserts or end on the lateral surface of the mandible as well as the lower border of the mandible. Remember that the mandible moves, so this is where a muscle insertion will be. Do you remember what the term action refers to? I hope so. If not, then I will tell you anyway. Action refers to what a muscle will do. The action of the Masseter Muscle is to elevate the mandible. When you elevate the mandible, you close the mouth. So, the masseter will close the mouth. The second muscle of mastication is the temporalis muscle. Here is a picture that shows you where it is located. Put your hands on the sides of your head. With your hands on the side of your head, clench your teeth. Now relax. Now clench. Now relax. Do you feel the muscle contract when you close down? The temporalis muscle starts or originates on the superior aspect of the temporal bone. Do you remember where this bone is located? The temporalis muscle inserts or end on the coronoid process and anterior border of the ramus. Do you remember where these areas are? I sure hope so. We just went over these in lab when we looked at the skulls. The action of the temporalis muscle is to elevate the mandible. When you elevate the mandible, you close the mouth. So, the temporalis will close the mouth. The temporalis will also retract the mandible. Retraction refers to moving the mandible backwards. put your hands back on your temples. Bite your teeth together. Now push your jaw to make you have a prognathous mandible. When you retract or pull the mandible back to where it is normally located, you will feel the temporalis muscle contract. The third muscle of mastication is the medial paraboloid muscle. The medial paraboloid muscle is also known as the internal paraboloid muscle. Due to its location, I can have you use your hands to actually feel the medial paraboloid muscle. I will show you where the muscle is by looking at another picture. In this picture, we cut the person's face in half. We are looking at the inside of their right side. Yep. We are looking at the lingual aspects of quadrants 1 and 4. Here is where the medial paraboloid muscle is located. If you think about it, the medial paraboloid muscle is like an inside version of the Masseter muscle. The medial paraboloid muscle has two sites of origin. The medial paraboloid muscle starts or originates at the base of the skull, specifically on the sphenoid bone, as well as on the back aspect of the palatine bone. Do you remember where these bones are located? I hope so. Your biology instructors would not be happy if you didn't. The medial paraboloid muscle inserts or ends on the medial surface of the ramus. Since we looked at the mandible in lab, I know that you know where the ramus is. Do you? Medial is the same as inner. The action of the medial paraboloid muscle is to elevate the mandible. Yep. It will close the mouth. The last muscle of mastication is the lateral paraboloid muscle. The lateral paraboloid muscle is also known as the external paraboloid muscle. Due to its location, I can have you use your hands to actually feel the lateral paraboloid muscle. I will show you where the muscle is by looking at another picture. In this picture, we remove the skin on the person's right side. Yep, we are now looking at the lateral aspect of their face. Here is the TMJ. Since you know about the TMJ from test number 6, I won't bore you with talking about it. The lateral paraboloid muscle is located here. The lateral paraboloid muscle starts or originates at the base of the skull, specifically on two sites that are on the sphenoid bone. The lateral paraboloid muscle inserts or ends on the neck of the condyle on the articular disc. I know that you know where the condyle is. Right. And I know that you know what and where the articular disc is. Right. One of the actions of the lateral pterygoid muscle is depression. Depression is the opposite of elevation. Since elevation is when you close your mouth, depression is when you open your mouth. The lateral pterygoid has two more actions. Yep, fascinating, isn't it? The lateral pterygoid muscle will also allow you to protrude your jaw. Go and bite your teeth together. Slide your mandible forward. You just protruded your lower jaw due to contraction of the lateral pterygoid muscles. The third and last action of the lateral pterygoid muscles will allow you to move your lower jaw from side to side. I know. You are asking yourself, how is this possible? Well, I will go ahead and tell you. Bite your teeth together. Put your hands on the TMJ. Now slide your jaw to the left. What did you feel? Interesting. You felt bulging in the right TMJ and nothing in the left. You should already know that the condyle sits in the mandibular fossa. The lateral pterygoid muscles attach onto the condyle and articular disc. When the lateral pterygoid muscle on the right side contracts, it pulls the condyle down the articular fossa towards the articular eminence. The left condyle does not move because the left lateral pterygoid muscle does not contract. This will cause the jaw to move to the left. This is an example of a unilateral contraction of the lateral pterygoid muscles. When you open or protrude your mandible, this will be a lateral contraction of the lateral pterygoid muscles. Man, that is so fascinating, isn't it? The last little bit of material that I need to cover will look at muscle actions. Elevation is a term that means the mouth closes. Elevation is due to the lateral contraction of some of the muscles of mastication. Can we remember which muscles will close the mouth? If you were awake and paid attention throughout this talk, you should know. Well, I am sure that you do, so I will not give you this information. Psych. Ha ha. Elevation occurs due to the lateral contraction of the masseter, temporalis and medial pterygoid muscles. Wow! 3 pairs of muscles to close your mouth. That is why you watch where you put your little fingers in a child's mouth when you are working. When they bite you, they can put a lot of pressure on your poor little finger. And yes, it hurts. Depression is a term that means that the mouth opens. Depression occurs due to the lateral contraction of the lateral pterygoid muscles. It only takes one pair of muscles to open your mouth. Have you ever watched someone wrestle an alligator? Say once they get the alligator's mouth shut, it is easier to hold shut. This is because there is only one pair of muscles to open the mouth. Tell the alligator wrestler to put his head into the mouth, and then let the alligator close down. Now impress us. Try and get your head out. Retraction is a term. That means that the mandible will move backwards. An example of this is when your lower jaw is pushed forward, and then you move it back to its normal position. Retraction occurs due to the lateral contraction of the temporalis muscles. Protrusion is a term. That means that the mandible will be pushed forward. An example of protrusion is when you want to impress your friends by demonstrating what a prognatic profile looks like. Protrusion occurs due to the lateral contraction of the lateral paraboloid muscles. The last of the muscle actions is lateral excursion. Lateral excursion means that the mandible will move to either the right or the left. Yep, sideways. Lateral excursion occurs due to unilateral contraction of the lateral paraboloid muscle. I will not talk about this again, since I talked about it earlier when I talked about the lateral paraboloid muscle. Trust me, we are all happy that I won't.
Well, hello. My name is Oscar. Peedy is goofing off and will be here shortly. I guess that I could talk about something. Nah, not me. Good. I can hear Peedy coming back.
Thanks, Oscar. Well, I hope that you have enjoyed the material on the muscles of mastication. Until later. Have a good rest of the semester and a happy holiday season. Remember to spend time with your loved ones.